So normally the extravillar cytotrophoblast, specifically endovascular trophoblast, okay, what they do, replaces the lining of maternal spinal arteries which open into intravillar space. Means they replace these endovascular trophoblast replaces the lining of maternal spinal arteries. Now what they do is they convert these spinal arteries, converting them from high to low resistant vessel. So we know that pressure is inversely proportional to volume. So in low resistant vessel, pressure is low and volume of blood flowing is more. So this maintains the uteroplacental flow. So there is a proper supply of blood to the fetus. This conversion from high to low resistant vessel is known as vascular remodeling, which is important, which occurred normally. But what happens in pregnancy induced hypertension or preeclampsia, there is a abnormal vascular remodeling and abnormal placentation. Means what happens in abnormal vascular remodeling is there is a resistance is high or the pressure is high, then volume of blood flowing through it is less. So there is a decreased uteroplacental blood flow, decreased blood supply to the fetus. We know that this vascular remodeling completed in 2 phases. First phase completed by the 12 weeks. The second phase completed by 18 to 20 weeks. The second phase is not completed in PIH. So the second phase is not completed in pregnancy induced hypertension. So vascular remodeling remains abnormal. So what are the stages in PIH or preeclampsia? There is stage 1, that is placental syndrome. There is a changes in placenta occurs. Why it happens? It occurs due to abnormal vascular remodeling, abnormal placentation, impaired trophoblastic differentiation or impaired pseudovasculogenesis. All these 3 factors lead to placental hypoperfusion. Means there is decreased blood supply to the placenta and decreased blood flow to the fetus. And placental hypoxia or placental ischemia. So this placental ischemia leads to the small size placenta. The size of the placenta decreased and decreased blood flow to the fetus. This leads to the IUGR, intrauterine growth restriction of the fetus, and decreased renal blood flow to the fetus, which leads to oliguria and oligohydramnios, decreased amount of amniotic fluid. This placental ischemia also leads to the maternal circulation, affect the maternal circulation. So this placenta, we know during this abnormal vascular remodeling, placenta releases increase. So to increase vasoconstriction leads to increase in the SFLT. This is the serum FMS like transaminase 1.